I'm Joe Manchin, Governor of West Virginia. Thank you, and I appreciate the commitment and leadership that both Governor Culver and Governor Douglas and so many governors are showing around the country for this very, very important endeavor. Like me, the three of us come from states that have rural areas where a lot of the people don't have the specialist. So it only makes sense that we move in this direction so that we can have the best of technologies to where everybody in our state can enjoy. We live in an age in which doctors and specialists could confer by video conference, in which medical images could be shared with a click, in which doctors can monitor chronic conditions remotely, and in which patients in the most remote towns of my state of West Virginia could connect to the best of urban specialists. What's hard for us to understand is our financial dealings are done like this every day, but yet the most important thing we have and the most valued thing we have is our health is not. And it doesn't make any sense whatsoever that we haven't moved in this direction. Incredibly, about 85% of all doctors are still operating in horse and buggy days of paper and pencil. And why? We're not here to blame. We're only here to repair. So moving health care information into the 21st century, it would deliver immense savings. The redundancies and also the quality of care for a patient would be unbelievable, and we believe very strongly. Just to give you an example of what type of money we're speaking about, just in one hospital in Washington, D.C., shifted to electronic medical records, they saved over $3 million. Proportionally, if you look at that, that's a minimum of $81 billion nationwide, $23 billion just in Medicare alone. So there's some tremendous, tremendous values for all of us there that we can continue to give better care. I have been fortunate enough that when I first got elected, I had one of our as we was transforming our government, we went through a complete operation looking at what we needed in the state, and I brought doctors together from all over, and we decided this was an initiative we needed to start then 3 years ago. Dr. Julian Bell is a neurosurgeon, a renowned neurosurgeon in West Virginia, took the lead on this, knowing that how the questions he receives from all over the rural parts of the state, and he's trying to answer, having this ability to image and having it working in the technology network would have make a great difference in his. But let me tell you just a little bit about what we have done. We have what we call West Virginia eHealth, and this initiative that works with all of our providers, our health insurers, businesses, and governments to facilitate the use of information technology to improve the quality, efficiency, and safety of our health care for all of our West Virginians. This initiative works to fulfill my pledge to put critical health care information in the hands of doctors, caregivers, at the time they need it most when care is delivered. Our plan has 4 goals. First, it promotes the use of electronic medical records in clinical practices. Second, it develops and oversees a statewide health information exchange network to connect doctors, hospitals, laboratories, and other health care providers. Third, it gives consumer access to personal health care records and the telemedicine services that are already in use in West Virginia. And fourth, it collects, analyzes, and delivers information to healthcare providers to improve the health of the state's residents. Helping us in endeavor, as I said, is Dr. Bells, who's been invaluable, bringing a practical experience and also the needs of West Virginians to our attention. We're doing all that we can in the states, but it's time for the federal government to step forward. It's time for Congress to act and act now. We mean that. The amount of money and energy and efforts that we're putting forward right now could all be for naught. If we spend the amount of money and time and energy and we connect our state, but I cannot talk to Chet or I can't talk to Jim, we're in serious problems. Then you start over. So that's why we're saying we don't understand why they have not engaged. So we're urging Congress, we'll be going to the Hill to urge them now to act as quickly as possible for the need of all Americans, and I think it'll be a great value. So I want to thank you all. And